When we're talking about this virus and someone is diagnosed with this virus, what can that patient expect to experience?
Well, I think the big point to make is that for the vast majority of people, they will get a cold. So when we go through the cold season every year, there are coronaviruses and rhinoviruses that are the major causes of those. This coronavirus is just a little bit of a different one in that it has a higher risk of causing lower respiratory tract or pneumonia type infections, which are the difficulty. The statistics are that it appears, and again, there aren't that many cases in the world yet, and it's all very rapidly shifting, is that young people may well just have absolutely no symptoms. And then people from young people up through about age 60 or so will have a cold. And it may be a significant cold, but it'll be a cold. And then the risk starts to go up beyond there for people at older ages or those with other underlying health conditions of any age. So if you have diabetes or asthma or heart disease or kidney failure, your risk of a more significant infection goes up. And in that 20% that has the risk, those are the ones that will probably, some of them will need medical attention. And then about 5% or so will become seriously ill and may need pulmonary support, ventilators, that kind of thing. So the big message is you want to try to somehow figure out who are those people at risk, spend your efforts there, and everyone else is going to just have a cold.
David, from the perspective of Columbia Valley Community Health, have you had many patients or potential patients coming in saying, I'm worried about this, can you test me? Or I'm worried about this, what steps should I take?
No, we haven't. Not yet anyway, but we anticipate that that may happen. And so our leadership has gotten together with our clinical staff and we've put some processes in place to deal with that. We anticipate that even now, somebody's been going on to Twitter or Facebook and has decided that they need to call the doctor. So while they may not be really in any serious danger, we take their concerns seriously. We want to try and, answer their questions as best we can.
What are the standards right now that are recommended for testing for this coronavirus? Are there certain requirements that patients have to meet before we would consider submitting their samples for testing?
Yes, and they're in flux as this condition spreads. But it is pretty much people with a respiratory infection and a history consistent with the travel to China or that area, or people who have a respiratory infection and close contact with somebody who has recently been to China. As the disease has spread, and we are now in some parts of the country seeing evidence of what's called community spread, where there's no travel history. The other group now is people with severe respiratory infections, no other known etiology, and those people are now eligible for testing.
Now, there are steps that potential patients can take before they go see a doctor or before they come into your ER. What are those steps that people should be taking if they feel, I'm sick, I feel like I might have an exposure?
Our doctors are telling them, look, this is very much like the flu. So the same things that you would do if you had the flu, we are encouraging people to do. Stay at home, get rest, drink fluids. If they're thinking, well, I don't have any symptoms yet, how do I keep from getting it? It's a lot of the usual suspects. Hand washing, hand hygiene is very important. 20 seconds, soap and water. If you do have a cough or you see somebody coughing, the important thing is maybe cough into your elbow. Just don't spray this. This is transmitted by droplets, by people sneezing or coughing. and just being careful when you're around people. Be kind of cautious and be careful where, frankly, you put your hands and surfaces you touch. Those kind of things. The things, again, that you do if you had a cold or you didn't want to catch the flu.
Can you talk about some of the protocols that you have talked about setting up at Columbia Valley Community Health for how to deal with this if we do see large numbers of patients?
So if that was the case, we do have a mobile clinic that we could put out in the parking lot of our main building, anticipating that that's going to be where we handle the folks that we really suspect are going to have the coronavirus. Theoretically, we could take one of our buildings or even part of a building and dedicate that. But again, the idea is separate them as much as possible. One thing, and patients aren't going to notice this, but we've started using a much stronger disinfectant. What we usually use takes about 2 to 3 minutes to kill any germs that are on a surface. We're bringing out a bigger gun, so to speak, and that'll do the same thing in less than a minute. Just some of those kind of things we're doing to ensure that both patients and our staff are okay.
And protocols at Confluence Health?
So we recognize that what you would consider the usual health conditions in a community are going to continue through this. And so we need to make sure we have facilities available for those individuals, and as much as we can, as David said, do our best to protect our staff, because if we don't have staff, we can't care for patients. So part of our protocol is going to be and is trying to figure out who really needs to be seen and who can continue to monitor themselves at home. And so that's why we are asking people to call before you come. And we will, like David, we will try to figure out who really needs seen and who doesn't immediately, but err on the side of caution for that. We're not trying to turn people away. We have set up a tent, which is outside of the Central Washington Hospital emergency room, and we are going to be asking everyone who has respiratory infection symptoms to go there rather than into the emergency room to begin with. And we will screen people there and try to triage who needs to be seen and who we can give self-care instructions to. Really just trying to keep the virus down to a lower level in the hospital. If people need to be seen, we have some negative pressure rooms in the emergency room so that they can be seen there and not get the virus into the rest of the building. And then if people need to be admitted, we have identified specific rooms that we will put people in to try to keep the rest of the facility at a lower risk.
Can you talk about the case that you're looking at now that is under testing for COVID-19 and when it came to your attention?
So the individual has been in the hospital for 3 or 4 days and initially did not meet the testing requirements because of their history. When the testing requirements changed, they then qualified for testing and the tests were submitted yesterday.
And in the meantime, how do you approach that patient's case?
So that individual is in isolation and the staff is wearing personal protective equipment when they provide care for that individual.
In other cases, in cases that so far have been detected in Washington, the epicenter has been assisted care or care facilities. And the people who have been now submitted for testing or asked to go into quarantine, many of them have been first responders or healthcare workers. Does that give the two of you concern for your nurses, your physicians, your staff, and trying to keep them safe?
Yes. But we are now, there is a heightened awareness. and we will be using personal protective equipment for individuals who are in the departments like the emergency room or the intensive care unit, who are at a higher risk of exposure to this infectious organism.
We do the same thing. We have some very stringent rules about who's going to be taking care of these kind of patients. Those personnel are going to have a heightened level of protection in terms of the equipment they're using. For somebody who doesn't really have a lot of direct patient care, me, I'm not going to be wearing anything special, but the nursing staff, the clinical staff, the providers, we will be giving them extra protection.
Does the Wenatchee Valley, from your perspectives, have any specific vulnerabilities? We have an older population generally. At the Columbia Valley Community Health, we see people who are of lower income and their standards of living might be different. Are there particular areas of vulnerability that the Wenatchee Valley poses when we're talking about the spread of a virus like this?
No, I don't really think so. I think at this moment the biggest risk is that the virus will come into the area from travel. We do have a fair number of people who travel in this region, but no different than anywhere else. And by and large, there are a lot of incredibly healthy people in this community, and that may be to our benefit as well.
Yeah, and I'd say that most of our patients, regardless of socioeconomic, they feel very strongly about connecting with family. And I'd say if there was anything, it would be the more people move around and travel or go different places, that might increase the likelihood of coming in with someone. But to be honest, I don't think we see that more here than any place else, and in many ways probably less.
Are your institutions getting the guidance and resources that you feel that you need from CDC, from state agencies that you cooperate with?
For instance, our State Association of Health Centers. We have ongoing reports and communications throughout the day. The Department of Health at the state level, and CDC is sending stuff out on a very regular basis. I can't speak for, inpatient care, things like that, but we feel we're getting a lot of support.
Yeah, I think that clearly the situation is evolving here by the day, but the Chelan Douglas Health District has been very helpful. The Department of Health, the CDC, they are putting out guidance daily, or even more than that if needed. There are webinars that we are all on. And so, yeah, as much what's known is being communicated pretty effectively.
Is there anything else you think that people watching should know about this particular virus and the way the medical community is responding to it?
I think we are doing our best to be prepared for whatever comes. We don't know what that's going to be, but I think the important thing is that everybody knows we're doing our best and being open and talking about it and preparing for what could be quite significant and hoping for something less is kind of where we're at.
I would just add that the health professionals in this valley are top-notch, and we are going to do absolutely whatever we can to help people. I would say, though, that individuals probably are going to be in a better position than we will to determine what happens with them. Again, if you're not feeling good, stay at home. If you do have to be out, wash your hands. It's those kind of things, the preventive things or the self-care that will probably have a big of an impact as anything we do.